someone exercise for depression, for instance, they look at you like you're crazy, right? And over time, though, the literature has built up more and more and more, which is good to see because we have more solidified evidence to really see the antidepressant effects of exercise. So much so that I believe in the last year or two, there was a meta analysis that was published, or a network meta analysis, that was able to compare the different interventions. So when we're in psychiatry, we often are met with this dichotomy of, do we prescribe medications? Do we do therapy? And it's just kind of simplistic terms. That's kind of what we do. And there was not really a whole lot in between. And what we're seeing is interesting. The evidence base now is that's comparing these treatments shows that their effect on depression is pretty similar. So when you're looking at medications, therapy, exercise, and those are all very broad terms. I acknowledge, like, there's different types of therapy, there's different types of medication, there's different types of exercise. But across the board, when you're looking at randomized control trial data, the effects or antidepressant effects are pretty much the same, which is reassuring. But again, there's a lot of nuances that we can speak about in between in terms of the differences. And one that I'll quickly highlight is, as I mentioned before, the multi-system benefits of exercise. So again, it's not just treating the depression per se, but it's treating other physical ailments that may be there, or bolstering someone's physical reserve that might be there, which has preventative value as well too, which is really, really important.
Absolutely. And before I forget, is there a cumulative effect if you do, say, for example, all three?
Hmm. Yeah, for sure. There's lots of evidence to point that these interventions, they don't need to be used in isolation. I think oftentimes what happens is when people hear the word exercise or even diet, for instance, you think that there's these separate camps that you have to be in. That if you're doing exercise, you can't use antidepressants or you can't do therapy, and it couldn't be anything further from the truth. There's smaller trials that are putting them all together as an intervention, but they do show this synergistic effect when you're combining multiple interventions, which I think is an important point to highlight, because if we keep them separate, we create, as I mentioned, these camps of treatment, when in reality it's best to use all of them together, or better phrase that what the patient wants to do or is able to do, it's best to kind of run with that, because that will lead to the best results.
Yeah, Nick, I'm hearing you say this all like this is another opportunity for personalization, like to look
Mhm.
at ways that really suit the patient and what would they would benefit or more likely allow themselves to succeed in. Like if you got somebody that's really keen on moving and less keen on taking something, adding the maybe the therapy plus the exercise might make sense. If they're someone that's not going to get off that couch,